Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever heard of Furanicles Boils or perhaps experienced one? These pesky, painful skin infections are more common than you might think. In the next few minutes, we'll be diving into the nitty-gritty of Furanicles Boils. We'll explain what they are, how they can disrupt your day-to-day life, and most importantly, how they can be managed. We'll also touch on the causes, the telltale signs and symptoms, how they're diagnosed, treated, and even how they can be prevented. Stay tuned as we explore the world of Furanicles Boils together. So, what causes these Furanicles Boils, you may ask? Well, fundamentally, they are the result of bacterial infections. Staphylococcus aureus, a common bacterium found on the skin and in the nose, is often the culprit. When this bacterium enters the body through a cut or a scratch, it can lead to the formation of these pesky boils. However, certain factors can make you more prone to getting Furanicles boils. Poor hygiene, for instance, can increase the likelihood of these bacteria penetrating your skin. Similarly, a weakened immune system may not be able to fend off the infection as effectively, making you more susceptible to these boils. Chronic diseases such as diabetes can also heighten the risk, as they often come with impaired immunity. So in essence, the main causes of Furanicles boils are bacterial infections, poor hygiene, a weakened immune system, and chronic diseases. Now that we know what causes Furanicles boils, let's find out how to identify them. How can you tell if you have a Furanicles boil? Here's what to look out for. Furanicles boils typically manifest as red, painful bumps on the skin. The area around the boil may be swollen and tender, causing discomfort or even pain. As the boil matures, it might fill with pus, forming a yellowish head. This is due to the body's immune response trying to fight off the infection. But the symptoms of Furanicles boils aren't just skin deep. In some cases, you might also experience systemic signs like fever and fatigue. This is your body alerting you that it's dealing with more than just a minor skin issue. Remember, the size, location, and number of boils can vary greatly from person to person. So even if your symptoms don't exactly match this description, it's always worth seeking medical advice if you're concerned. Recognizing these signs is the first step towards diagnosis and treatment. So how are Furanicles boils diagnosed and treated? Well, the first step in diagnosing Furanicles boils generally involves a physical examination. Your healthcare provider will look at the boil, note its size, location, and whether it's draining. They might also ask about any other symptoms you've been experiencing, such as fever or fatigue, to get a better understanding of your overall health. In some situations, a lab test may be necessary. This typically involves taking a sample of the pus from the boil and sending it to a lab for testing. This helps determine the type of bacteria causing the infection and can guide the treatment process. Once a diagnosis has been made, treatment can begin. This often involves antibiotics, which are designed to kill the bacteria causing the Furanicles boils. It's crucial to take these as directed by your healthcare provider to ensure the infection is fully eradicated. Warm compresses can also be used to provide relief. They help bring the boil to a head, which can speed up the healing process. In severe cases where the boil is large or not responding to other treatments, surgical drainage might be necessary. This involves making a small incision in the boil to drain the pus. Remember, every case is unique, so treatment will be tailored to your specific needs. With the right diagnosis and treatment, Furanicles boils can be effectively managed. But wouldn't it be great if we could prevent them? Yes, prevention is certainly better than cure when it comes to Furanicles boils. These painful, pus-filled lumps can be kept at bay with a few simple yet effective preventive measures. Firstly, maintaining good hygiene is key. Regularly washing your hands and body with a mild soap and keeping your skin clean and dry can help prevent the bacteria that cause Furanicles boils from spreading. Secondly, boost your immune system. A strong immune system is your body's best defense against infections. Consuming a balanced diet rich in fruits and vegetables, getting regular exercise, and ensuring adequate sleep are excellent ways to bolster your immune health. Lastly, manage chronic conditions. If you have conditions like diabetes or dermatitis, keeping them under control can reduce your risk of developing Furanicles boils. So, don't overlook these preventive measures. They may seem simple, but they can make a significant difference in your health. Remember, your health is in your hands. Stay informed, stay healthy. UMCC, your ultimate medical consultant connector.